Let's admit it, there's something special about Grenada. Now, you can call me biased because I am Grenadian after all, but you have to confess, this little Caribbean island has done a pretty good job of defying the odds in managing this deadly global pandemic. At present, Grenada has absolutely no active COVID-19 cases, and this comes after having recorded 148 cases in total, in which every individual recovered except for one. Now, Grenada's COVID-19 reality did not come without its challenges. The government was quick to shut its schools in March before the virus ever got to our shores, and later shut the ports and enforced a 24-hour curfew, all in a bid to manage the spread of infection in Grenada. To this end, Grenada was able to maintain lower double-digit infection rates for the greater part of 2020. However, in December of last year, the peace of mind and comfort that Grenadians had come to enjoy rapidly disappeared. Infection rates started to rise, and suddenly the island that had accumulated 43 laboratory confirmed tests between March 2020 and December 13th suddenly had 59 active cases on island by December 24th. Now, spikes are not uncommon in the global construct. One only has to look to Grenada's Caribbean neighbors and to the greater world as evidence. What is, however, uncommon is the ability of countries to quell those spikes in a short period of time. Grenada has. According to the country's Minister for Health, the Honorable Nickolas Steele, what sets Grenada apart are the subtle differences in its people, its government's policies and procedures, testing policies, quarantine policies, entry policies, and much more. With the country having received 3,000 of the Oxford AstraZeneca vaccines through the COVAX facility on February 10th, the government has begun the process of protecting the population from the deadly virus. As of publication, 146 individuals, including Grenada's Prime Minister, Dr. Keith Mitchell, and Minister Steele, have received their first dosage. I recently had the opportunity to sit down with Minister Steele to speak candidly of his post-vaccination experience and in general about his team's management of this international crisis.
First of all, well, thank you for taking the chance to sit with us and My Grenada Solutions. We really appreciate you making the effort and just sharing your time with us. So I wanted to ask you first and foremost, what has it been like for you leading the contingency that has been managing the health of this nation, especially during this global pandemic? And also, how have you as a person been able to personally deal with the stress and anxiety of being at the charge of this front, while also managing the Ministry of Health, while also being a businessman, and also being a family man, first and foremost?
Well, it's been difficult. It's been a unique, life-changing experience. It's in terms of managing it personally, jury's still out on that. So far, I've made it this far, but it's really, it's a once in a lifetime, once every 100-year event or so, and it's been something that fortunately or unfortunately I drew the card. So therefore, the responsibility has been mine to get us through this.
Well, how would you say you've grown then as a minister and as a person throughout this entire experience?
I truly believe I can take on anything else now. There is nothing more that can be thrown at me that I don't think I'd be willing to accept, take on, or live up to the challenge. This has been one that came straight out of left field. It is simply getting past this now is going to make a big difference personally and nationally for us.
I think personally, a lot of us here in Grenada could say we've seen you get a few gray hairs during the period.
And then some, yes, yes.
And as we mentioned, Grenada, we live in a Caribbean where we're surrounded by other nations who themselves are struggling to deal with this pandemic. And many of them have been where we are now, where it was under control and they had spikes and they haven't been able to sort of get it under control. What do you think has set Grenada apart in its ability to successfully tackle and quell the upsurges we've had in the rate of infection here?
Well, we are very similar to our Caribbean islands, but there are subtle differences. Subtle differences in our people, there were subtle differences in government policies, procedures, entry policies, quarantine policies, testing policies. Those have to be taken into account as well. But I think significantly has been our government's ability to make decisions in a timely manner, make sometimes tough decisions, but decisions that have shown to be the correct ones, and take the bit of medicine early in order to stop the spread as quickly as possible. It's come at a significant economic price. It's come at a significant psychological price, not just personally, but to the nation's psyche as a whole, I think, has paid a price. But we believe that first loss, so to speak, was the best one to take. We regret what we see happening with our neighbors. Our heart goes out to them, and we offer any assistance or so advice. We're here for them in the same way we know they would be here for us.
And last week we had the opportunity to see you and a couple other ministers and our Prime Minister take the first dose of the AstraZeneca vaccine. Now, of course, there's a lot of talk going around the world about the effects of the vaccine. What has been your experience since taking your dosage, and did you have any anxiety for what would happen post-vaccination?
Not really, no. I have had faith in the science. I've been fortunate enough while going through this also being a director on the WHO as Minister of Health for Grenada, so I've been interacting with many colleagues at the highest levels. And I have every faith in the WHO process of selection and approval for emergency use of vaccines. And therefore, we have stuck to our principle that we would not use a vaccine unless it was approved by WHO PAHO. And therefore, once the vaccine that I was going to be inoculated with was one that was approved, I'm quite comfortable with it. I've had no side effects. It has been a confidence booster, and I do see with my other colleagues and up to today, those who have received today too, it really has made a difference, subtle though, but psychologically has made a difference to people.
Okay. When are you expected to take the second vaccine?
My second dose, I'm scheduled to take it on the 9th of April, 8 weeks from the first dose.
Now, WHO indicates that the efficacy of this particular brand of vaccine increases throughout the 12-week period from the first time you take it to the second dosage up to 80%, which means there is still always the risk factor for infection even with vaccination. Has the government considered any sort of PR initiative to sort of sensitize and get Grenadians aware that, look, even with vaccination, there's still a risk for infection?
Well, two things there. One, the efficacy rate is up to about 90 now. And technically that's the same rate of accuracy on the PCR test, which is widely accepted that we use to identify the virus as well. I believe personally, and we believe within the Ministry of Health Grenada, that once an individual is vaccinated with both doses, that their body will be able to handle it. Now, individuals will still get COVID-19, but the body will be able to deal with it, and the risks are significantly reduced almost to a negligible level. Between now and then, we still have to exercise our caution because there are others around us that are not yet vaccinated, vulnerable individuals as well, and we all have to get to our second dose.
What is the anticipated rollout schedule for this batch of the vaccines? I know that World Health Organization has their own prioritization roadmap. Are we following their roadmap, or have we designed one based on our unique circumstances here?
This present batch of 6,000 doses we expect to use up before the end of this month. So within the next 2 weeks. We are following the procedure guidelines of WHO Pan American Health in terms of frontline workers first, then our elderly and persons with comorbidities. The difference or slight variance because of Grenada and the fact that we are a tourism-based industry is that individuals within the hospitality sector are also considered to be second level frontline.
Okay. In terms of when you actually do get more batches of the vaccine and rolling it out, do you think, is there ever going to be a situation where there's a charge even nominally for the rest of the population, or is this a situation where everyone will get the vaccine for free?
Yes, there would be a charge, and the model on that, for instance, we've got 8,000 St. George's University students. So in us procuring for them, they would pay for their students to get vaccinated unless their students can get vaccinated in their home countries before they come back. And within the hospitality sector as well, there has been a willingness and there is an intention to have individuals pay for their vaccines. The first set of vaccines are donated or come without any cost to Grenada. But in order to fill the entire amount needed nationally, there would be a charge. And that charge has to be for those who can afford, will help subsidize for those who can't.
Do you envision people being able to pay to get theirs quicker?
It has been discussed. I think I prefer to look at it not as individuals paying to get their vaccine quicker, but that government making sure that it makes available the vaccine to the less vulnerable, more vulnerable, and those who may have difficulty affording, and then allow the private sector to have access, private doctors, private clinics, etc., to have access to the vaccines as well, so that we all move forward collectively. The assumption is that in that instance, they may pay or charge their clients for the vaccine. In the interim, though, we want to make sure that it is not about those who can afford to get it first. We want to make sure most definitely that it is frontline and the most vulnerable. As we get to the end dates, close to the 50% vaccinated, 60% vaccinated, we may allow that to happen.
How much individuals do you anticipate we will be able to vaccinate before the end of this year?
Well, we're looking to get to our mark of 50 to 70% of our population vaccinated by the end of this year. In fact, before that, we have an estimated target right now of 1,500 to 2,000 individuals per day being vaccinated, being able to possibly run that at 7 days a week. That is with the engagement of our other stakeholders like St. George's University and the private sector. The restrictions on how quickly we will get to that figure, it's not just based on our capacity, it is going to be based on vaccine acceptance by the population as well.
That's a good one. In terms of the brand of vaccine, I know you mentioned before that there isn't that much difference between the different brands, but why AstraZeneca, and did the government have a say in terms of the brand of vaccine that was received here?
We did have a say. First and foremost, the brands that we look at would only be those that are approved for emergency use by WHO Pan American Health. At present, AstraZeneca, Pfizer are approved, and Moderna. It is impossible for us to get our hands on Moderna because contractually they are bound to supply only the US. We do have facilities on island for the extreme cold chain that the Pfizer-BioNTech vaccine has. And the AstraZeneca does not need that cold chain. So our first choice in all of those three was the AstraZeneca, so that because it doesn't have the challenges for the extreme cold chain. But we would access, if we were able to get our hands on it, some of the Pfizer doses. And we are looking at some of the other vaccines that are soon to receive EUL from WHO, which would be probably the Sputnik and the Sinopharm. Those would be vaccines that we would also be looking to add into our formulary.
As we close, is there anything that you'd like for Grenadians or even Grenadians in the diaspora or foreign investors to just know about this island in terms of how we've been coping with COVID? What your expectations are for us looking forward, given our current circumstances? What do you think, or how do you think Grenada is going to ride out the rest of this COVID wave, at least for the next quarter, first half of the year?
Well, you know, we are a small country, and as such, there have been significant challenges in getting prepared for, in dealing with this vaccine, in being able to put certain social structures in place for individuals who've been unemployed. We don't have the ability that many first world nations have, but we have used the resources, what little we have, and the ingenuity of our people to put together a plan that thus far, with the grace of God, has worked. And we intend to continue to place all our energies on this. We intend to get through this. We intend to have Grenada, because that same issue of size, which restricts our ability to respond ideally, also is a benefit with respect to coming out of this pandemic, with respect to the size of population to be vaccinated, and also how quickly we can bounce back, or that we would be ready to be open for business. And we look forward to that. And the one thing that I tell my team, and I keep focusing on myself, is that after the last pandemic of the 1918s, there was a period called the Roaring 20s. And we are looking forward, once we are past this hurdle, to being open and to experience the Roaring 2020s post-COVID-19.